Good day, parents. I do hope that you and yours are doing well. And it is indeed a wonderful privilege for me to be sharing a very important topic with you today. I just thank you for your time and I do crave your indulgence. My name is Tasha Brown-Burke and I'm a dental assisting student. Now, our children, we love them, right? Yes, and we want to see them happy. But there's something that may affect their happiness. They have tiny teeth, but guess what? Big problems can develop because of early childhood caries. Now, the objective of this presentation is to educate you, to sensitize you on how you can prevent early childhood caries. I want for you to be able to know how to care for your child's teeth. I want to encourage you to show you the importance of bringing your child to the dentist at an early age so they can get the care that they deserve and need to prevent early childhood caries. At the end of this presentation, you should be able to identify the causes and risks of early childhood caries, demonstrate how to properly take care of your child's teeth, and understanding the role of fluoride and diet and early dental visits to prevent early childhood caries. Now, we'll be looking at what early childhood caries is, causes of early childhood caries, the effects it has on our children, and eventually on us as parents, preventative measures, and treatment options. What is early childhood caries? Now, early childhood caries, my parents, are caries or cavities that will develop on the teeth of children under 6 years of age. Now, these are very young children. And as we look on the slide here, we see the mouth of a child with the anterior or the front teeth taken over by cavities. And so because children start erupting their permanent teeth at age 6 and onwards, so we're looking at the cavities that affect them before that stage. What causes early childhood caries? When we put our children to bed at night with the bottle or on the breast or a bottle of juice, and we don't brush the teeth and we don't clean the mouth, we allow them to sleep night after night, week after week, month after month, what's going to result? This early childhood caries. So because when we don't brush your teeth, bacteria develops in the mouth, acid is in the mouth, it breaks down the teeth and causes them to develop early childhood caries. Here we see on the picture here the baby with the bottle in the mouth, and we see where caries are developing or cavities are developing on the teeth of the child. Now, when a child has caries, what happens? Is it just like that? Life goes on? No, it doesn't. It affects them. Pain. Some of us who have had cavities, we know what toothache feels like. We know it affects our lives, right? So they are going to get pain. They may get infection caused by an abscess, poor appetite. They won't be able to eat because they are feeling pain. Disturbed sleep. Not only them, but us as parents, we have to be up with them in the night, trying to soothe them, trying to comfort them, right? Emergency visit to the dentist. The child having a toothache, we'll have to go with them to the doctor, whether the private or the public dental clinic, which we know is a long wait. And if it is that the cavity is so bad it can't be filled, then they will need an extraction. For some children, whether for developmental reasons or other reasons, in order to have a successful dental treatment, they will have to be put to sleep. Now, when they have toothache, my friends, and they're at school, most naturally they won't be able to focus because they are in pain. Also important to note that when our children lose teeth early, especially at the back, when those permanent teeth are coming down, they may not come in proper alignment, and so their teeth may be not where they ought to be, and so you will now be forced to seek the orthodontist to put on braces on the child's teeth, and that is a very expensive treatment. Also, if we don't teach our children the importance of oral health, then they're going to have problems in adulthood, also with dental issues. And when our children have cavities on the primary teeth, it can cause the permanent teeth waiting in the wings to also develop cavities. And that's very serious. We also know that dental treatment in Jamaica It's very expensive. And when our children do have teeth in the mouth, it affects how they speak. And children, they do have self-esteem issues too. They don't want friends to laugh after them, right? Now, how can we as parents prevent early childhood caries? Remember, we're talking about 6-year-olds here. They are children, they are babies. So it is our responsibility as parents to take the lead in taking care of our children's oral health. So what we do, we clean their teeth with a soft rag or toothbrush twice per day and before bedtime. What should we not do? We should not let them fall asleep on the bottle, right? We should not let them fall asleep on the breast. And if they do, that's fine. But what we need to do is to ensure that their mouth is clean, their teeth is cleaned before they go back to bed. Because over time, if we don't do that, they are going to develop early childhood caries. We should reduce sugary snacks, acidic things such as soda, right? We get in the chubby and all these things, which is not healthy for the teeth. And we should schedule our children's first dental visit within the first year of life. So let us get them to the dentist early in life so they'll get used to the environment, get used to the dentist, and they won't feel so scared when they are to go to do a procedure. Teach your children healthy eating habits, so cut out the sugars and so, and also teach your children at an early age to brush their teeth and to floss so that they will not have these problems as they become adults. However, if things got out of hand and now they have early childhood caries, what we'll have to do is, there are several options. One, depending on how severe or the condition of the cavity, the dentist can choose to do a filling, right? So they can fill it, they can restore the tooth, right? And the child will have to get a local anesthetic to numb the area so they'll be comfortable throughout the procedure. Also, there is a procedure that does not require them to get a numbing, and that's called the silver diamine fluoride. But this treatment it has a silver color, right? And what it does, it slows down the cavity and helps to protect the teeth because it has fluoride, and fluoride helps to strengthen the enamel and fight against cavities. Now, the cavity is deep. The dentist may do a pulpotomy, which is removal of the pulp at the top. Now, the pulp is what gives the teeth nutrients, right? But if the cavity is deep, they can do that and try to restore what is left. So the child will have functionality like chewing and all of that. But if that can't be done, then they will have to do an extraction. Now, fluoride varnishes help to protect the teeth from cavities. It helps the teeth to be resilient against cavities. So when you bring your children to the dentist from early and the dentist is able to track their development, they'll be able to put on the varnish on the teeth from time to time to prevent your child from getting early childhood caries. I just want to thank you for allowing me these few minutes to have a discussion with you. I hope that you learned something and now you'll be able to go home and put these things into practice. Do not leave your child on the breast or, whatever it is. Important thing is to clean their teeth before they go to bed so that they will not develop early childhood cavities. I know you love your children and you want the best for them. So let's preserve their smiles for the future. Thank you so much for your time. Do have a wonderful rest of day.